Let's begin with a case such as this, in which the patient has prematurely lost the lower primary cuspids and the posterior teeth are lingually inclined. So what we'd like to do, we'd like to upright the posterior teeth and maintain that leeway space, which is the difference in the size differential between the primary second molars and the bicuspids. So in order to do that, we need to place a lingual arch in this patient. Before we can do that, before we can place a band on the tooth, we have to place separators. The separators allow us to make a little bit of a space so that we can fit the bands, and then either fit the bands and make the appliance, or allows us to have some space that we can take the impressions and send the impressions to the laboratory so they can fabricate the appliance for you. There's different types of separators. There's separators that look like continuous circles, and there's some separators that have little knobs on the ends to help keep them from moving. Two different ways of placing the separators are, you can use a instrument such as this, which is similar to a rubber dam clamp instrument, and you take a separator and you place it into the appliance there, and basically you're just moving it back and forth until the bottom part of the separator is beneath the contact point and the upper part is above the contact point, and then release your instrument and the separator is in position. Another method of placing separators, which is the one I prefer, is by taking two pieces of dental floss and you tie them through this, just loop them through the separator so you can stretch the separator. And then you can come in and you slide the separator through beneath the contact point, and then just gently work it slowly so that, again, the separator surrounds the contact point. And then just remove the dental floss, and the separators will stay in about 7 days. And this allows enough space to develop so you can fit bands on the teeth. When the patient returns to the office, you can remove the separators either with a scaler or an explorer. And either you can take your impressions at that point and send them to the laboratory and have the lab fit the bands and make the appliance for you, or you can fit your own bands if you have them in stock. The way you fit the bands is basically you want a snug fit, but you don't want it so snug that you have to force it. So just gently slide down, and just the top of the band should just be at the marginal ridges of the teeth. Once you have your band selected, then you're ready to fabricate your appliance. On the lab script, if you're sending this to the laboratory, you would take the impressions. Another technique is you can fit the bands and then take the impressions. You can take them with an alginate impression material. You can use a styrofoam tray and then pull the bands in with the impression and send them to the lab in that manner. You can also take them with a PVS material, say like a pentaquick material, and send them into the lab. Now once the teeth are separated and the bands are in place, you're ready to fabricate your appliance.